So, what is the American patient-doctor relationship today? Well, it doesn't look too much like what Norman Rockwell painted in The Doctor and the Doll in 1929. If we look at the patient-doctor relationship today, it's very unique being in this country. It's a very special relationship. I have the ability to, understand and get to know patients very well. I have the almost freedom to do mostly what I want to do. I'm not restricted by certain drugs or formulary to some degree. I do have to answer to an insurer who pays for those medications or devices or procedures, and certainly we negotiate how that works. But in other countries, as you imagine, the payer is right in between. Doctors really can't prescribe whatever they want. If there's an issue, the government or that payer is going to determine what is going to be given. And that payer or the government is also worried about what other patients and what other doctors are going through. They're thinking about society as a whole. And while there might be a lot of restrictions and barriers to that way of healthcare, there are some issues with not understanding the societal consequences of what we do between patient and doctor in this country. Managed care in the 1990s and all the way through today really reduced our length of stay with our patient visits. You go back 30, 40 years ago, you could spend quite a bit of time. Now the average length with a primary care provider is 13 minutes. It's not very much time to talk about opioids, all the risks, all the benefits. I'm spending an hour with you going through all this stuff. Imagine me just first getting to know people, what's wrong, and then finally talking about these drugs. As you can imagine, a lot of physicians just make the conversation shorter by writing a prescription. Here you go. Have a good day. And they don't dive in to all the risks and benefits that are necessary. And then, of course, in the last 10 to 20 years, we've had patient satisfaction surveys, the Press-Ganey scores, the HCAHPS. And some people, some physicians think, well, if I want to keep my patients happy, I'm being rated, I'm being judged, my payment comes from that, I should give them something for that. I should give them a prescription. Now, obviously, I don't agree with that at all, but there are people who feel that way.